Hi everyone. Today I am giving an explanation on the topic the watering eye. This is the watering eye part 4, in which I will cover the clinical evaluation part, which consists of two things. First one is lacrimal syringing test and the second one is Jones diet test. Now the Jones diet test again get divided into its two parts. First one is Jones test 1 and this one is Jones test 2. So let's move to the lacrimal syringing test. Okay, this test is most widely used for checking the reason of watering. So how we will done it? First of all, with the topical anesthesia, normal saline is pushed into lacrimal sac from the lower punctum with the help of a syringe. First of all, we will use the topical anesthesia for the numbness, so the patient do not feel any kind of pain throughout the test. Okay, now we have to fill our needle, or we can say syringe, with the saline. Okay, here the saline is filled as shown in the figure. Okay, so we have to insert the syringe into the punctum of a patient and till the canaliculi. Okay, from the lower punctum. Then we have to insert slowly the saline which is filled in the syringe. A free passage of the saline through the lacrimal sac passages to the nose rules out any mechanical obstruction. Now free passage is seen here and our saline get reached to different parts of the lacrimal apparatus. Okay, in the presence of partial obstruction, saline passes with considerable pressure of the syringe. If there is any partial obstruction is present, then saline passes with the considerable pressure of the syringe. If there is any partial obstruction is present, then after passing the saline, it will rules out that partial obstruction. In the presence of obstruction, no fluid passes into the nose and it may reflux to the same or opposite punctum. Okay, now if there is total obstruction present, then the saline will not reach to the different parts. Okay, it may reflux out from the same punctum, which means we are doing sac syringing from the lower punctum. Then in that case, the saline will comes out from the lower punctum, or it is also possible that it may comes out from the opposite punctum, which is our upper punctum. Okay, so if it will get reflux out from the same or opposite punctum, then we will reaches at the result of the obstruction in the lower sac or NLT. Okay, so these results indicates the obstruction in the lower sac or NLT. This was the whole information about the first test, which is the lacrimal syringing test. Okay, let's move to the next, Jones diet test. Now this test is performed with partial obstruction is suspected. If we will get the partial obstruction, then this test is performed. No value in the presence of total obstruction. If the total obstruction is present, then it will give no value. Now we have the two parts of the Jones test. So first of all, we will discuss about the Jones test 1. It is also known as Jones primary test. Okay, or we can say that the another name of the Jones test 1 is the Jones primary test. This test is performed to differentiate between, now we have two conditions and we have to move further with only one condition. So only one condition is present in the patient. So we have to identify first of all these conditions. First of all is watering due to partial obstruction of lacrimal passage. There is any partial obstruction in the lacrimal passage due to watering occurs. This is the first condition. And the second condition is due to primary hypersecretion of tears, which means in this case there is a primary hypersecretions, which means the messages are sent to the lacrimal gland for the watering, or sometimes the patient use parasympathomimetic drugs which sends messages to the parasympathetic nervous system for watering. Okay, now we have to take out any one condition out of the two, or we can say that any one condition out of the two is present in the each patient. Okay, so from coming out of these condition or this problem, we have to perform Jones test 1. Okay, let's see the procedure. 2 drops of fluorescent dye are instilled in the conjunctival sac. Now what is the conjunctival sac? The conjunctival sac is present inside the lower eyelid, where the lower eyelid as well as our eyeball get attaches to one another. There is a hole is present which is known as a conjunctival sac. Now in that sac, 2 drops of fluorescent dye are instilled and the cotton bud is dipped in xylocaine. Xylocaine is basically used for the numbness, so the patient do not feel any kind of pain throughout the test. Is placed at the opening of NLD. Now let's see in the diagram given below. Here in the conjunctival sac, the fluorescent dye is instilled. Okay, we are seeing that yellowish is the fluorescent dye, and the bud is placed, okay, at the side of nose, and after dipped in a xylocaine. Okay, now after 5 minutes the bud is removed and suspected. After the 5 minutes of the first step, we will remove the bud and suspect it. Now two possibilities are seen. First one is the stained bud and the second one is unstained bud. Okay, two possibilities are seen. We will see the stained bud or the unstained bud. Stained bud indicates that this is a positive test, okay, and the unstained bud indicates that this is the negative test. Now if the test is positive, or we will see the stained bud, then it indicates watering is due to the primary hypersecretion, which means the messages are sent to the lacrimal gland for doing watering. And if we are seeing the negative test, now this test is the positive test because we are seeing here the stained bud. Okay, if the test is negative, which means we are come with the suspicion of the unstained bud. Now the unstained bud indicates that this is a partial obstruction or failure of lacrimal pump mechanism. Okay, now in case of this, any partial obstruction is present, which means now here the partial obstruction is seen. Okay, so the water do not reach, saline do not reach in the the dye do not reach at the other parts due to the partial obstruction. Okay, so first reason is that the partial obstruction is present anywhere, and the second reason is that of the negative test, which is the mechanical pump failure takes place. Okay, next, Jones test 2. When the primary test is negative, now we will only done Jones test 2 at that time if the Jones test 1 becomes positive. Okay, now how to do this test? The cotton bud is again placed at the inferior meatus and lacrimal syringing is performed. Now we have to again place the cotton bud here and have to perform this lacrimal syringing test. Okay, again we will get the two results, positive test or the negative test. Okay, positive test means stained bud and the negative test means unstained bud. If the positive test we will find, then it suggests that dye was present in the sac but could not reach the nose due to partial obstruction. Now if we are seeing the first test, which is the positive, in this test we are noticing that here the stain get reach. How? We have to perform the lacrimal syringing test, and we will come to that conclusion that the dye was present inside it, but due to any partial obstruction it will not reach at the bud. Okay, if we are again going with the negative result, then it indicates that there is a presence of lacrimal pump failure. In this test there is a lacrimal pump failure which indicates this. Now I have completed with all of the tests of watering. Thanks for your patience listening.